People wind up at state-run mental health hospitals when they're at their most vulnerable. But state records show that DCF employees trusted to help them are understaffed and overworked. Some are working an average of 80 hours every week.
That's almost like working, 2 full-time jobs.
Is working so many extra hours putting patients in danger?
Yes, and staff.
My brother's not safe in these hospitals anymore, and he's not getting the proper treatment.
The burden is falling on the backs of patients with mental illness, the workers, and you, the taxpayers. Let's see what's brewing. I'm Jenna Bourne, and I'm an investigative reporter at 10 Tampa Bay. If you're new here, welcome to our caffeine-fueled homemade deep dive into issues that matter to you. Make sure you subscribe so you don't miss an episode.
You were seeing hallway footage of another patient attacking my brother who was in the shower naked.
We've blurred this video, but the chaos is clear. You're looking inside Florida State Hospital, a mental health hospital run by the Florida Department of Children and Families. Jonathan Hereford's brother, Sean, was being treated there for schizophrenia. Jonathan is Sean's legal guardian, and he says he believes there was inadequate staffing to protect his brother.
There was a lack of staff supervision in the actual bathroom itself. So another patient came in there and he took one of those hard, wet floor signs and bashed my brother in the skull with it while he was in the shower.
A hospital report lists 2 employees who got involved in the hallway scuffle that came after.
Those 2 individuals that were staff could not handle that situation. Our loved ones are in these hospitals, and the lack of staffing is affecting every aspect of somebody's life that's in there.
10 Investigates found DCF-run mental health hospitals Florida State Hospital in Chattahoochee and Northeast Florida State Hospital in McClenny are so understaffed. Some employees are working an average of 80 hours every week.
That's almost like working, 2 full-time jobs.
How do we find that out? We sent a public records request to the state agency that handles human resource management for state employees, the Florida Department of Management Services. We asked them for the top 25 overtime earners among state employees, and pretty quickly we noticed a pattern. The number of DCF employees who made the top 25 list has doubled every year for the past 3 years. The top overtime earner in the state last year worked for DCF. She made more than $55,000 in overtime pay alone. That's as much as the average Floridian household makes in a year, according to the US Census. And that extra money comes out of taxpayers' wallets. We showed our findings to Ben Wilcox. He's the research director at Integrity Florida, a nonprofit research institute and government watchdog.
I think it would be appropriate for a legislative committee to investigate and try to determine why these employees are having to work so much overtime.
All this brought us to the question, what the heck is going on at DCF? So we asked them, well, not in those exact words. And they tell us all 20 of the DCF employees on the top overtime earner lists work as nurses, direct care staff, or security officers at Florida State Hospital and Northeast Florida State Hospital. Those mental health hospitals are both in rural parts of the state and require 24/7 staffing. I caught up with DCF's deputy secretary on the phone. Do you think that all this overtime is an efficient use of tax dollars?
I would argue, what's the alternative? The alternative is that we have to do staff aug contracts, which are significantly more expensive than allowing folks to work overtime.
I'm sorry, staff aug? Can you clarify?
Staff augmentation contract out.
But despite all that overtime, state audits have found there are not always enough people on shift at those 2 hospitals. This audit, published 2 months ago in October 2020 by the Florida Auditor General, says Florida State Hospital and Northeast Florida State Hospital did not always comply with minimum staffing requirements. Is all this overtime putting patients or staff in danger?
No, not at all. In fact, I think it's making sure that we have the standards of care that they should expect. We want to make sure that our staffing ratios are at the right place and the entire time, throughout the 24-hour period.
Is working so many extra hours putting patients in danger?
Yes, and staff. Absolutely.
Paul Whittingham has been working at Northeast Florida State Hospital for 20 years. He's also a local union president.
The staff are tired. And when you're tired, we all know that mistakes can happen. Your reflexes are not what they should be. Your response time is not what it should be. You know, it just puts a lot of people at danger, at risk.
He says all that overtime is caused by one thing: low pay.
You have an awful lot of staff that volunteer to work the overtime because they need the finances, they need the money.
Whittingham also blames low pay for the hospital's struggle to attract and keep employees.
I know people that stock shelves make more than vast majority of the staff at Northeast Florida State Hospital.
We're here today to keep fighting for that wage increase.
After union demonstrations in January, Florida lawmakers approved a 3% pay raise for all state employees.
Prior to this year, it's 12 years since state employees had a pay raise.
Is that 3% pay raise going to make a difference for these hospitals?
No, not at all.
Hereford tells us it's people like his brother who pay instead.
My heart breaks. Are we trying to have a bare bones system, or are we trying to be actual effective and help people out?
But that state audit from October I told you about a couple minutes ago, it shows COVID-19 is making the problem even worse. Within that audit, DCF responded that the pandemic is causing critical staff shortages at Florida State Hospital. DCF says it's using CARES funds to get supplemental temporary staffing from an employment agency. And they've had to reassign rehabilitation therapy staff to residential areas to meet staffing minimums. Thanks for watching What's Brewing. Subscribe to this channel so you don't miss an episode, and I'll see you next time.